Dr. Smith, physical therapist here, and today I want to talk about healthcare provider suicide. So this is something that's not really talked about, but it needs to be talked about. More light needs to be shed on it. As of today, August 11th, 2019, we are on average losing one physician per day to suicide. This is the equivalent of losing around one graduating medical school class per year to suicide. And I do believe that this is going to trickle down into other professions, such as my own physical therapy. Now, the reason I believe this are the commonalities that we see of massive student loan debt and being overworked and underpaid. And ultimately, when you actually get to your job and perform your duties, it's not what you thought it was going to be. You know, you went to school to be a healer or rehabilitator. You spent all this time, this money, this knowledge, this education, and you get out of school and you're basically just a data entry worker. You're checking boxes in the computer. If you're in the hospital, it's how many RVUs can you bill? And in school, you weren't taught about RVUs. You weren't taught how much money your license brings in, how much revenue it generates, or how much you should be fairly paid. If you're a physical therapist, it's how many CPT codes can you bill? How many units can you bill? And again, you're not taught how much revenue you're actually bringing in based on your license, and if you're being paid fairly for the revenue that you're generating. But ultimately, we all went to school to be the best versions of ourselves, to be healers. Maybe it was our calling. Maybe you just want to help other people. Either way, you have all this knowledge, this education, and you are spending time with patients. Sometimes it's not as much as you want, but you're just spending a lot of time documenting and just clicking numbers. And it has to do with insurance, reimbursement from the top down, whether it's hiding behind Medicare or lobbying in Congress or so on. Again, when these policies came into play, they did not look at the long-term outcomes. Same thing with student loans, where everyone gets blank checks now to basically pay whatever for the full cost of attendance. And it's created a huge problem because schools can then charge whatever. Same thing with insurance. When these were implemented, they did not realize how this was going to affect frontline healthcare workers. So what can we do about this? Well, we can talk about it, number one. Number two, if you are considering suicide because you feel it's going to erase all of your debt, please call 1-800-273-8255. 1-800-273-8255. That's the National Suicide Prevention Lifeline. If you're dealing with somebody that's telling you like, oh, why'd you take out that much money and make this much money? Or why'd you do this? Why'd you do that? Again, things have changed over time, just like cost of inflation, cost of living, everything like that. Things change. Right now, if you want to be a doctor of physical therapy or be a physical therapist, you have to have a doctorate. And you're probably going to pay a good amount of money for it. And people are going to say that's crazy for paying that much money for the amount you make, but it's your only option. I'll use myself as an example. So I lost both my parents before I was 20 years old, and I had no one but myself to rely on. And I had 3 animals to take care of after my mom died, who I found in the pool of her own blood after a pulmonary embolism. So after dealing with that shit, I was fucked up. And honestly, if my animals weren't there, I probably would have considered suicide because I'd literally lost everything. You know, my dad was gone the year before, and I lost my mom, and I basically found her in the pool of her own blood after a pulmonary embolism. If I didn't have my animals, I would have been fucked up. And I probably still am a bit fucked up from that. Not gonna lie. But then if you add, massive student loan debt on top of that, then yeah, it's a recipe for suicide. Like I wouldn't be surprised if people thought I was gonna kill myself after that based on all the bad shit that happened to me in those 2 years. But going back to the point of what I'm getting at is, so after that, I lived off life insurance that I luckily had from my mom through all of undergrad. I was working part-time. Then through grad school, I worked part-time. And if I didn't become a physical therapist, I wouldn't be making the amount of money I'm making today, number one. Number two, I probably would have ran out of life insurance money much faster, and I probably would be working a dead-end job or be homeless or doing something else. So for me, my only option really was to become a physical therapist. And people are telling me like, oh, you should have done something else. Well, when you find, your mom in the pool of blood, you have no one to go to, and you have animals to take care of, then yeah, maybe I should have done something else, but you're not me, everything is different. So then when people used to tell me, oh, you don't have any experience with anything, you don't have any life experience, like everything's relative, again. And the point of this video is that people go through bad shit, and adding the loans on top of it, telling them that, oh, they shouldn't have done that, they're idiot because back in your day it was stupid. It's creating a toxic environment, creating poor mental health. And I've had people reach out to me who have thought about killing themselves as a physical therapist because they have so many loans and they took a bad sign-on offer and they just don't know what to do, but they know if they kill themselves that it goes away and doesn't follow them and they don't want to deal with it anymore. Again, if you are having thoughts like that, please call 1-800-273-8255. This needs to be addressed, and again, it's a bigger problem upstream from Congress, just like the insurance that I talked about, where this really has gotten out of control, and we're gonna see more of this. And if you don't think we are, then you're blind to the fact. And yes, there is now oversaturation occurring in physical therapy in some areas where multiple schools are opening up. I don't know why the fuck CAFTA or APTA or whoever is not regulating that, because when you have supply and demand economics and you look at an excess supply with schools opening up constantly, salaries are going to go down as student debt continues to go up. So it's going to be the same thing we're seeing in the physician model, where again, people are going to be like, oh wow, I just wasted all this money. I can't get paid what I'm worth. I'm not getting paid the average when I looked at BLS before I went to school. I'm not treating the way I want. And again, if you're not doing cash pay or doing your own thing, or maybe finding a silo in home health like I did, then yeah, it's gonna be stressful and you're gonna think it's a huge waste of fucking time and money. And I get it. You know, I think that if you don't get it, there's something wrong with you on being able to show empathy. So hopefully this video is informative. Again, you know, you can look up these stats yourself. There's multiple videos out there showing this. I believe right now physicians are the highest, but I won't be surprised if physios are next in the next few years with everything that I talked about. All right, guys, thank you for watching. Comment below if you have any questions.